Welcome to Roadmap to Residency, Evidence-Based Application. This is our first video of the module Public Health Sciences. Now, what is public health? So public health is the sum of all official or governmental efforts to promote, protect, and preserve the people's health or the public's health. So the science and art of preventing disease, prolonging life, and promoting health and efficiency through organized community effort is called as public health. Or the process of mobilizing and engaging local, state, national, and international resources to assure the conditions in which people can be healthy is called as public health. Or we can say the science and practice of protecting and improving the health of the community as well preventive medicine, health education, control of communicable diseases, application of sanitary measures, and monitoring of environmental hazards is called as public health. Now, this definition may be too long for you. You do not need to memorize this definition, but you will fully understand the basic idea behind public health in this video. So, again, public health is what we as a society do collectively to assure the conditions in which people can be healthy. It is a science and art of saving the lives of millions at once by single decision or intervention. Now, public health is so by now you know that public health is many things. It is a system, it is a profession, it is a method, it is a government service, and it is the health of the public in general. So the public health system, so we need to assure the conditions of population health. Okay, we need to look after the healthcare delivery system. We need to look after the community. We need to look after the governmental public health infrastructure, the academics, the media policy, the employers, and the businesses who are a basic part of the public health. Now, there is a public health model and a medical model. Now, the difference between these two models are the public health model generally focuses on the population, the disease prevention, health promotion, the interventions that need to be done in the environment and human behavior. But as a medical model, what we do as the medical doctor, as an internal medicine, or as a surgeon is that we focus on individual, we focus on the diagnosis, treatment, and intervention. Now, what we see as a physician is only a tip of the iceberg. Okay, this is what we see in the hospital. We see patients in hospital, but the physician does not see, or what the public health physician sees is the patients in the community with mild or no symptoms, with the patients which are doing the self-treatment and the treatment which have been done elsewhere. Okay, now as a physician, as a surgeon, we only see this tip of the iceberg, whereas there is a variety of, or there is a large pool of public which is not seen by us, because they may have mild symptoms, they may are doing the self-treatment, or they may be at a risk of developing the symptoms. What are the core functions of public health? So there are three main functions of public health, which is assessment, policy development, and assurance. By assessment, we monitor the public health, we diagnose and investigate. We go for policy development, we inform, educate, and empower the public. We mobilize community partnership, and we develop policies for public health. And in assurance part, we enforce laws, we link to or provide the care, we assure the competent workforce, or we evaluate the public health. What are the core activities of public health? Now, the core activities of public health are it prevents the epidemics and the spread of the disease, it protects against the environmental hazards, it responds to disasters and assists in communities in recovery, it prevents injuries, it promotes healthy behaviors, it assures the quality, accessibility, and accountability of health services. It helps in monitoring the health status of the population, in mobilizing the community action, in reaching out to link high risk and hard to reach people to needed services, researching to develop new insights and innovative solutions, leading the development of sound health policy and planning. Now, you may or may not get direct questions from this video, but this video is very, very important to understand the rest of the chapter. What are the 10 great public health achievements by far? Now, these are the examples of different public health achievements: vaccination, motor vehicle safety, control of infectious diseases, decline in deaths from the coronary heart disease and stroke, safer and healthier foods, healthier mothers and babies, family planning, safe drinking water, recognition of tobacco as a health hazard. Now, these all are the public health achievements that we have achieved. Now, There are some public health problems and diseases. There are communicable diseases, there are non-communicable diseases, which all prevail in the community, in the public. There's environmental pollution, which is directly or indirectly related to the public health. There are maternal child health problems. We will be having a module on maternal and child health too. The malnutrition and micronutrient deficiency, municipal and hospital waste, geriatric health problems, population problems, some diseases like measles, influenza, poliomyelitis, tuberculosis, cholera, dengue, malaria, AIDS, obesity, cancer, and diabetes. These all are the prevailing health problems and diseases in the population health. Now, we need to talk about the prevention of diseases. Now, this slide is very, very important, and you may get a question from this slide. Now, there are different stages of prevention of disease in the population. Okay. Now, first of all, there is a primordial prevention. Now, primordial prevention is when there is no development of risk factor at all. Okay, that is called as primordial prevention. Now that is a basic concept, and that is impossible to do. Okay, no development of risk factor is not an option. There is always some risk factor in the environment, and there comes the primary prevention. The primary prevention is when there is the risk factor in the environment, but we need to prevent the population from getting affected by this risk factor. You know that the primordial prevention was to not develop risk factor at all. Okay, to not the risk factor to not let the risk factor to develop at all in the community. That is not possible. But what we can do as in primary prevention is that we can prevent ourselves from getting affected by those risk factor. For example, healthy diet and exercise to prevent diabetes. Susceptible population is when there is a secondary prevention. Okay, susceptible population where we do the secondary prevention, where we screen for and manage the pre-symptomatic disease. For example, glucose screening for type 2 diabetes mellitus. Tertiary prevention is when we treat to reduce the complication, okay, in asymptomatic and early disease patients. For example, hemoglobin A1C monitoring to guide and prevent the complications in diabetic patients. And then comes the quaternary prevention, where we quit the unnecessary medical interventions to minimize incentive harm, and this mainly focuses on palliative care. Now, we know that in primordial, for example, you can say for diabetes, now unhealthy diet is already there in the environment. We cannot fully cut off the unhealthy diet. Okay, this is unhealthy, this is healthy. We will not sell unhealthy food in the market at all. We cannot do that. But what we can do is that we can stop ourselves from eating that unhealthy diet. That is called as primary prevention. Now, we were unable to have the primary prevention, and now there is a significant risk factor for the patient to develop the disease. So what we can do is that, for example, if a patient is obese, if the patient is obese, then there is very high risk of him developing the diabetes. So what we do is that we screen the patient yearly for the diabetes. Okay, now that is called secondary prevention. And tertiary prevention is when the patient has already developed diabetes, but we treat the condition. We give insulin, we give anti-diabetic medications, and we treat the condition and we reduce the complications. Now, quaternary is when the patient is already fully affected, and we target to just decrease the complications plus increase the palliative care of the patient. That is called as quaternary prevention. That's all for this video. Thank you for watching.